Is yoga okay to do if you've herniated a disc or thrown your back out? Patients ask me that a lot. And my answer to that right off the bat is probably not. But there's definitely one yoga exercise that I will prescribe to people once they're on the mend, which I think kind of bulletproofs their back towards not being injured in the future. So let's take a look into why I think yoga isn't a great idea when you've blown a disc or thrown your back out, and what pose you can do in the long term. Let's take a look. So I'm going to start off by saying that lumbar disc herniations and throwing your back out in what I call a doozy, meaning your lower back is jacked up and you can't move for a day or two. When these things happen, not all of the time, but most of the time, this is a result of flexing the lumbar spine forward and sometimes flexing the lumbar spine forward and twisting at the same time, very often to pick up a weight or a load. So let's take a look at this photo right here. This is definitely someone who is flexing way forward. And if you take a look there really closely, you can see also that this individual is also a little bit rotated. So that type of thing repetitively, I'm not a huge fan of because I think a lot of times it can lead to a herniated disc. I also think that lower back pain and disc pain, etc., doesn't have to come from one instant just like this described. It can be more along the lines of sitting in a certain position for a long period of time, kind of chronically, such as when you're working, etc. And in regards to lumbar flexion, or that forward flexion, let's take a look at these quick little videos right here just to demonstrate. You can see here that I'm sitting in a pretty low chair. I mean, this is a pretty horrible example of something that I would sit on if I was going to be working on a computer, etc. But believe it or not, people sit on far worse things than this when they work. So you can see here when I'm sitting that my knees are a little bit higher than my hips. And that kind of rolls my pelvis backwards and rolls my lumbar spine into a little bit of flexion. So not really ideal. I usually don't recommend that for many of my patients who've herniated a disc. Now, we could also take a look here at just kind of a regular height seat. This is a little bit better. I'm pretty tall, but you can tell right here that the knees are about at the same level of the hips. It may not still be ideal, but certainly better than our first position. And now for a dramatic effect here, I'm taking a couple of cushions and I am placing them on top of a seat. This looks rather messy, but once again, I'm just kind of making a point here. When I take a seat on top of the cushions, which are on top of the seat, you can now see that my hips are higher than my knees. And that just kind of naturally takes my pelvis and puts a little bit of a reverse tilt on it and straightens my back out. So if you look here, it is much easier to sit in a neutral spine or a less flexed spine if your hips are higher than your knees. So rule number one here, or I guess I should say piece of advice number one, is if you're having disc issues, try popping your seat up and see if that kind of gives you some relief. Same thing goes with cars. I hate bucket seats in cars because they dump you low. Your knees are usually higher than your hips and it rolls your posterior pelvis or your pelvis posteriorly, which is not great for lumbar discs. So if you're having disc issues or you've had a lumbar herniation, maybe get a little cushion underneath your seat in your car. And by the way, if you're sitting with your pelvis rolled back all day, such as the demonstration in that low seat, you are not only putting stress on your lumbar spine, you are also adaptively shortening your hamstrings. If you think about where your hamstrings originate and insert, when you roll your pelvis back like that, you are putting your hamstrings kind of in a short position. And I do think a lot of people that have stiff and short hamstrings, part of the rationale as to why that happens to them long term may be because they sit in this type of position. So all the more reason to get yourself out of that position. So what position do I like to prescribe patients that's yoga or yoga-ish long-term when they have this kind of flexion issue in their spine? I want to make sure I pronounce it correctly. I think it's called an Uttanasana, otherwise known as a standing forward bend. Now, what we're going to do here is I'll show you some video footage of this position. And what we're doing here, in a nutshell, is we are trying to train your lumbar spine or your lower back to stay straight and not flex. So that, I'll say that again, super important. We want your lumbar spine to stay perfectly straight, almost in a locked position while we're doing other motions. And we're kind of separating our hip motion away from that. So as you can see from the video here, what I am doing is I am just keeping a preserved lower back. And I tell people kind of almost stick your belly out so as to make sure that your lower back is not flexing. And we're just going to practice doing a little bit of a forward bendy through the hips and not the back. And by the way, this is a great way, I've said this before, it's a fantastic way to gain length in your hamstrings. And it even strengthens them a little bit too, your hamstrings and your posterior chain. So just doing 1 or 2 sets of 10 of keeping your back nice and straight, and then just kind of giving that forward bend through the hips. And when you feel a little tension in your legs, that's where you stop. You don't have to obviously go all the way down to a horizontal position. Do what you can, and then just kind of push yourself back up and maintain that lumbar spine locked straight. Now, for those of us that have a really hard time kind of understanding where your body is in space, I see those people all the time. I call them the motor morons. That's a light joke, but there's definitely a prevalence of that in the population. If you can't tell where your back is, I will have some people take a Swiffer stick or a broomstick or otherwise just a straight rod and put it behind their back and kind of use that as a tactile feedback. You want your back staying as straight as that rod and kind of use that as a feedback. And basically, I'm doing the exact same exercise that I just described to you, just while holding a bar behind your back. Pretty easy to do, or easier to pick up the actual sensation of what it should feel like. Let's say you're really remedial and it's really difficult to even start that position because you're kind of too worried about your lower back. You can stand in front of a table and just put your hands on the table so you have that extra support. So you're de-weighting yourself. So try doing the exact same drill of just keeping your back locked straight, hands on a table. And it's almost like you're doing like a little mini push up on the table using your hands to support yourself. It's a nice, easy way to kind of build up confidence and strength. So, to answer that question, should or can I do other yoga positions when I've had a herniated disc or I've thrown my back out? You can try other yoga positions. I would keep your lower back pretty much straight. So the standing stability positions, like the warrior one, warrior two, I like. They're not too dangerous. Would I do a forward fold? No, skip it. Because it once again, there's that lumbar flexion going on. And not all discs herniate or backs get thrown out this way, but kind of makes me scared. And that's not something I would try until at least until the point that you have zero back pain for a long time. Feel free to subscribe, rate, and review to our channel. That helps a lot. And I hope to see you again. We'll talk about more topics related to your musculoskeletal health. Have a good one. If you have any questions about lumbar spine disc herniations and yoga, drop them in the comments. Happy to take a look at it.